Okay, can you guys hear me now? Can you hear me? Can you hear me? Oh my goodness. Ah! This has been a day. Hello, 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 YouTube world. Oh, thank you, Betty. Okay. Hello, hello, hello. I know you guys have all been waiting. I'm super, super sorry. Um, Thank you so much for your patience. Have you ever gotten a brand new computer and you had to set up all of your programs and all of the things that you use on a daily basis? Well, I've got my new computer now, so I can continue to do the video editing. And so I'm working with my brand new computer, but all of these programs that I used to do this live had to be set up and configured. And I thought I had done that yesterday, and it turns out the main program that I use lost all of its settings. So I had to go through today really quickly and try to get everything set up so that you can see and hear me. So, woo! This has been a interesting morning. So I'm so sorry that you guys were delayed. I truly truly apologize. Hopefully next time I'll be a little bit more prepared because I think I got everything set up now. So, with all of that dispensed with, let's talk about today. So, this is our. I'm only taking. Oh, yes, it does look that way. Oh, I don't know what to do about that. Okay, hold on just a second. Let me see if I can figure out. Let's see. Let's see if I can do this in real time. Is that helpful? This is the one I want. Okay, well, okay, so you can see me now. All right, well, almost. We'll worry about the fine details later. We'll worry about the fine details later. The rest of them, I think, are set up okay. Okay. So, Betty says, let's see here. Oh, okay, so you guys can hear me now. Can hear me? Test plan. Okay. Yeah, give me 1 second. Let me see if I can fix that. There we go. How's that? Can we see now? Good? Good? Okay. All right, so this is our game show. Normally I'm a little bit more organized than this, not always, but we're going to do the best we can with what we've got. Um, this is our twice monthly game show. We do this on the first and the third Tuesday of every month at 11 a.m., where I give you 15 test like questions. And you guys get to answer them live in real time, and you are actually competing for prizes. Now, I'm having some trouble with showing you the prizes, and I do apologize for that. But let me see what I can do here. Because all of my graphics did not transfer over, and I can't find some of them. All right, so let's look at Okay, can you hear me now? Can you hear me now? If you can hear me now, give me a thumbs up. Can you hear me now? Can you hear me now? Yes? Maybe? Yes. All right, we are back in business. All right, thank you, thank you, thank you. Okay, so first place, you are competing for. Yeah, if you could see what I got to do on the back end for all of this, all the little details you got to put in there so that you can see and hear me. It's crazy. Okay, so first place, you guys are competing for a T-shirt. You can choose the cheat shirt, which has all of my little sayings inside the letters. You can pick from. Let me take that one away. Let's see here. You can select a pink heart shirt, which is a big pink heart. Says "Called to Care." You can. Let's see. This is the class shirt, the one that I have on right now. The class shirt. Make that a little bit bigger for you guys. Uh, the class shirt, I've got it on the front just so you guys can see it, but normally it's printed on the back. And then we have Become Inspire Care. This is one that I wear a lot. I really like this shirt. And it's because that's what we do. We become the best version of ourselves, we inspire others, and we care. So you can choose from one of those t-shirts. Second place is going to get a card game. And the card game doesn't show up on here for some reason. The card game is this right here. It's the CNA Principles card game. Why won't that show up? I don't know. The CNA Principles card game. And it's a really fun game. It kind of goes over all the principles, but it's a rummy style game. There's a lot of strategy to it. You can play it with people that aren't in medicine. So it's just kind of a really kind of fun game. And then third place, and I don't have one of these with me right now. I just redid my entire office. I can't find anything. Oh, thank you. Thank you, Blue. I appreciate that. Heidi, Blue. Okay, so what was I saying? My ADHD is kicking in today, guys. I'm just so scattered everywhere. Okay, so the third place prize, you get a badge holder. And I don't sell these badge holders. They really are a true badge of honor. You have to win them. So third place is going to get a badge holder and some motivational gifts. So those are the prizes that you are competing for. Let's figure out how to play. And of course, we're just going to keep it small for a minute. I'm going to display the question on the screen. You will have 60 seconds from the time the question pops up until that screen goes away. You'll have 45 seconds to answer. So 60 questions from the time you see the question. I'm going to read the question and the answers to you. You're going to choose the right one. You can either put in the chat 1, 2, 3, or 4, or you can do A, B, C, D, but I prefer the numbers 1, 2, 3, and 4 because my system reads that a little bit better, okay? So when you see the question, you're going to read it, pick your answer, put it in the chat, and hit send. And my system is going to read the answers as they get to YouTube. If you're after the game is over, it gets awarded points. If you're in the top 1, 2, 3 place, you'll get your prizes. Please remember, we only send prizes to the United States. I'm not set up to ship internationally. I'm so sorry. Okay. Oh my goodness. Are you ready to get started late? I know. I know. We've got about 20 seconds before we're going to get started. So grab your drink, grab your popcorn, whatever you need to play, and we're going to get started here. All right. Here we go. Question number 1. Remember, put your questions in the chat and hit send. Quickest right answer gets the most points. Question 1. A resident suddenly has chest pain. What should the CNA do first? 1. Give the resident an aspirin. 2. Give the resident water. 3. Stay with the resident and call the nurse. Or 4. Help them walk it off. So a resident suddenly has chest pain. What should the CNA do first? 1. Give the resident an aspirin. 2, give the resident water. 3, stay with the resident and call the nurse. Or 4, help them walk it off. Go ahead and lock in your final answer. You've got about 15 seconds left. I hope you guys can all see that good. All right, about 3 seconds left. The right answer here, you guys all got this one right. Great job. You're going to stay with the resident and call the nurse. Now, some of you that have had CPR training may have learned that giving an aspirin with chest pain is a good idea, but that's not in the scope of practice of a CNA. So this is a little bit of a tricky question. Even though CPR standards say an aspirin might be indicated, we don't know enough about the patient, their medications, their health history, or anything else. So it is not in our scope of practice to do that in a clinical setting. Giving them water or helping them walk it off is not going to help them a bit. This is an emergency and it requires emergency intervention. Catherine came in first on that one, followed by Andina, Rosdanya, and Blue. Question 2. A diabetic resident looks shaky and confused. The CNA should 1. Offer a high sugar snack and notify the nurse. 2. Give insulin. 3. Put them to bed. Or 4. Ensure their safety and notify the nurse. So a diabetic resident looks shaky and confused. The CNA should 1. Offer a high sugar snack and notify the nurse. 2. Give insulin. 3. Put them to bed. Or 4. Ensure their safety and notify the nurse. Go ahead and lock in your final answers. Blue says, this week I was teaching a home health aide class and was surprised how many people would just drive the person to the ER in this case instead of 911. Oh, that's scary, Blue. Yeah. Got it. Yeah. Wow. All right, the right answer here is, you guys all got this one right. Number 4, ensure their safety and notify the nurse. Now, I want to talk about this really quickly, and I'm going to pause this for just a second because this is something that I've been wanting to talk about, right? We've all heard about the rise of AI, right? Artificial intelligence, and how it can help with a million different tasks. I went into AI and I asked it to generate some questions that are similar to a CNA exam. It gave me this question, but it actually marked number 1 as the right answer. And the reason that I bring this up, number 1 is not the right answer. We do not offer a high sugar snack. And it's super important that we understand that a lot of the questions that you'll see online moving forward are going to be written by AI instead of actual nursing professionals, because this is a shortcut. It's an easy thing to do, right? People can make AI write questions, they can throw them up and make some money off of you. So it's really important that you understand AI does not understand truly your scope of practice. So the questions it writes is not truly going to prepare you for the test. And if you look at this question, the question looks okay, but if you were on a practice test site and you got this and you were told number 1 was the right answer, it is not the right answer, you would potentially learn the wrong thing for the test. So I say this because we're going to see a lot more AI generated content online, and that's what you guys are using to prepare for the test. So please be careful. Please make sure that when you are selecting study material, you are selecting the right study material and not something that was written by AI. And it's going to be really, really hard in the future to sort through that, that content. So just be careful here. And it really surprised me that AI thought you should give a high sugar snack and notify the nurse. That's kind of scary, guys. Number 1 could definitely be dangerous. Absolutely. All right. So Catherine came in first, followed by Nathabo and Blue. Good job. Very good. Okay, here we go. Question number 3. A resident vomits suddenly. What should the CNA do first? 1. Clean the resident up. 2. Leave the room. 3. Hold all food and fluids. Or 4. Give them crackers or ginger ale. So a resident vomits suddenly. What should the CNA do first? 1. Clean the resident up. 2. Leave the room. 3. Hold all food and fluids. Or 4. Give them crackers or ginger ale. Go ahead and lock in your final answer. I'm going to look at these comments while you do that. Oh, Jen. Oh, my goodness. Yeah. Call 911. Chest pain always gets 911. Always, always, always. Yeah, Blue, you're absolutely right. 911. Yep. Good job. All right. So, what do we want to do here? The right answer here is to clean the resident up. The rest of those actions mean absolutely nothing if they're still covered in vomit, guys. Nobody wants to be covered in that. Cleaning them up. Sometimes we start to get so involved in our tasks, our steps, that we forget that underneath here is a human. And that's what this question is all about, to remind you that there's still a human under all of this. So we got to get that person cleaned up. Holding all food and fluids, that is a good idea until we get with the nurse to find out what the next step is. Offering graham cracker or some sort of cracker or ginger ale, that might settle the stomach, but we can't do that until we get permission. Don't leave them alone. 2 is not the right answer. All right, Catherine came in first, followed by Danica, DeJennifer, and Nell. All right, question 4. A resident begins choking and cannot speak. The CNA should, 1. Encourage them to drink. 2. Perform abdominal thrusts. 3. Leave to get help. Or 4. Hit their back hard. So a resident begins choking and cannot speak. The CNA should, 1. Encourage them to drink. 2. Perform abdominal thrusts. 3. Leave to get help. Or 4. Hit their back hard. Go ahead and lock in your final answer. Okay, I'm just going to do something here real quick while you guys are working on that. Okay, that is good. I've got something I want to talk to you guys about after we're done with these questions. It's actually very important. The right answer here, yeah, you guys all got this one right. Perform abdominal thrust. If somebody cannot talk, they cannot breathe. If they cannot cough, they cannot breathe. So if they cannot breathe, there's something obstructing, and we got to get that something out, which requires abdominal thrusts. So if somebody cannot speak or cough, we don't encourage them to drink anything. We don't leave them alone. We don't hit their back. We simply perform abdominal thrusts. These used to be called the Heimlich maneuver. That's what it used to be called. It's now called abdominal thrusts. And it's very, very important that we know that that's an emergency situation. Emergencies always require action. Catherine came in first on that one, followed by Andina, Danica, and Amelia. I hope I'm saying these right. Question 5. What is a common sign of a possible stroke? 1. Red rash. 2. Chest pain. 3. Slurred speech and arm weakness. Or 4. Hand tremors. So what is a common sign of a possible stroke? 1. Red rash. 2. Chest pain. 3. Slurred speech and arm weakness. Or 4. Hand tremors. I know this one's kind of an easy one, isn't it? Yeah. You guys are all so smart. I love hanging out with you guys. You make this fun. All right. You've got about 15 seconds left. Go ahead and lock in that final answer. And remember to stay tuned to the end of this, because I want to explain to you something about the test that most people don't realize. Something that's very important. All right, the right answer here is number 3, slurred speech and arm weakness. Yeah, and this is very, very common. So when you suspect somebody might be having a stroke, you want them to speak a simple sentence like, tell me what city you live in, or something like that. You want to have them hold their arms out to see if they're, have equal lateral strength. You want to look at their face for any facial drooping, and you want to look to see. I mean, are they confused? Is this, is their mentation baseline or normal for them? Yeah, that's it's. You have to know those signs because strokes require immediate intervention. Catherine came in first, followed by Nathabo, Nell, and Renee. Good job, guys. Question number 6. A resident becomes suddenly confused. The CNA should: 1. Reorient them and report to the nurse. 2. Leave them alone. This is normal. 3. Provide a light snack. Or 4. Help them lie down. So a resident becomes suddenly confused. The CNA should reorient them and report to the nurse. Leave them alone. This is normal. Provide a light snack, or help them lie down. So go ahead and lock in your final answer. You got about 20 seconds left. Yeah, this one's not too hard. This one's not too hard. I'm going to tell you what the key word here in this question is, though. About 5 seconds left. The right answer here, of course, is number 1. We want to reorient them and then report this to the nurse. If you see the word suddenly in any test question, suddenly is your key term. Nothing in healthcare should happen suddenly. Everything sudden requires a nurse's intervention. So if you see that word suddenly, you need to look in the answers for something that says report to the nurse. Always look to see what that's paired with. Like, I wouldn't want to give them orange juice and report to the nurse. But since number 1 is the only answer that has report to the nurse, it makes it the right answer. And I certainly would try to reorient them if possible. Catherine came in first on that one, followed by Danica, Nathabo, and Renee. Good job, guys. Question number 7. Which of the following is a behavioral change to report? 1. Resting or taking naps. 2. Eating smaller meals in the evening. 3. Attending a religious service. Or 4. Sudden withdrawal from activities. So which of the following is a behavioral change to report? 1. Resting or taking naps. 2. Eating smaller meals in the evening. 3. Attending a religious service. Or 4. Sudden withdrawal from activities. Go ahead and lock in your final answer. You've got about 15 seconds left. What do you guys think? And you can use the same rationale I used on the last question to answer this one. Yeah, the right answer here is sudden withdrawal from activities. Again, that term sudden clues us into the right answer. Nothing in healthcare happens suddenly, not when CNAs are concerned. So sudden anything has to be reported. Now, resting and taking naps, that is probably pretty appropriate for older individuals. Eating smaller meals in the evening, that's also pretty common in older individuals. Attending a religious service, a religion that tends to be a part of one's life if it's part of your life throughout your lifespan. But anything sudden has to be reported. So Catherine Johnson came in first, followed by Andina, Danica, and Nathabo. Question 8, half done. The CNA sees a resident having a seizure. What should they do? 1, hold them down. 2, place something in their mouth. 3, clear the area and call the nurse. Or 4, go find the nurse. So a CNA sees a resident having a seizure. What should they do? One, hold them down. Two, place something in their mouth. Three, clear the area and call the nurse. Or four, go find the nurse immediately. Go ahead and lock in your final answer. You've got about 15 seconds left. Go ahead and lock in your final answer. If you guys like this game show format, give me a thumbs up or something on YouTube. That way YouTube knows you like this. Clear the area and call the nurse. Now, why wasn't four right? Four is all about getting the nurse too. It says go find a nurse immediately, but that term go, that's the problem. Because in an emergency, you never want to leave a patient. We don't leave patients in emergencies. So that's what makes number four not the right answer. Clear the area, because somebody in a seizure can't control what their body is doing, and we don't want them to hit something hard. We don't want an injury to complicate matters. So we want to clear the area and oh, hold on a second. Yeah, I'll talk to you about that. We want to clear the area and notify the nurse. Okay, Blue asked a question here, so I'm going to pause this for a second. Blue says, where did the thinking of put stuff in the mouth come from? And let me explain that. This is a very old thing, but I don't know how old my people are that are attending this. It used to be, back when I was a very young nurse, it used to be that we instructed people to put what we called a bite stick in the mouth during a seizure to hold that tongue down so they didn't bite their tongue off. But what ended up happening is that bite stick often provided an occlusion and would rob the patient of their air. It would occlude the airway. So it actually became what we thought was a good thing, became a bad thing. So anybody that has learned that or has heard that along the way, we don't ever put anything in anybody's mouth during a seizure. We just want to clear the area and send somebody to get a nurse for us. Stay with the patient. Number 9, which action is correct if a resident falls? 1, help them up immediately. 2, call the nurse and stay with them. 3, move them quickly to bed. Or 4, assess for fractures and confusion. So which action is correct if a resident falls? 1, help them up immediately. 2, call the nurse and stay with them. 3, move them quickly to bed. Or 4, assess for fractures and confusion. So what do you want to do? Remember our scope of practice. What do CNAs want to do if a resident falls? So go ahead and lock in your final answer. You've got about 10 seconds left. The right answer here is to call the nurse and stay with them. Number 2, we don't help them up. In fact, we do everything in our power not to allow them to get up. We tell them, no, stay where you are. I need the nurse to take a look at you first. We do not move them quickly to bed. We do not assess for fractures or confusion. That's not our role. That's the nurse's role. So our job is just to maintain safety and make sure the patient gets the help they need in the form of a nurse. Remember, with emergencies, you never leave the patient alone. And I need you to remember that. In an emergency, we never leave the patient alone. So number 2 is the correct answer here. Catherine came in first, followed by Renee, Nathabo, and Amelia. Question number 10. A resident's skin is red and blistered after spilling coffee. The CNA should 1, cover with a cool cloth. 2, rinse with ice water. 3, apply a burn lotion. Or 4, switch them to iced coffee. So a resident's skin is red and blistered after spilling coffee. The CNA should 1, cover with a cool cloth. 2, rinse with ice water. 3, apply a burn lotion. Or 4, switch them to iced coffee. Go ahead and lock in your final answer. You've got about 20 seconds left. Now, this is a first aid question. Remember, emergencies require action. Emergencies require action. So what action do we want to take here? This is all about first aid. The right answer here is number 1. We're going to cover it with a cool cloth. You do not want to rinse it with ice water. That sudden change in temperature from hot to ice cold can actually cause more tissue damage as the blood vessels shrink away from that ice infusion. So ice water is not the right answer. Cool cloth, yes, we want to cool that area down so that tissue stops that burning, but we want to do it gradually with a cool cloth. We do not apply burn lotion, and we do not switch them to iced coffee. Anybody that put 4, that's absolutely not the right answer. But we do not put a burn lotion on there unless you're specifically told to, but this is an emergency. So Renee, Nathabo, Danica, and Amelia came in top 4. Question 11. The CNA notices shallow breathing and blue lips. What should they do next? 1. Cover with a warm blanket. 2. Check for a DNR order. 3. Apply oxygen. Or 4. Notify the nurse immediately. Go ahead and lock in your final answer. The CNA notices shallow breathing and blue lips. What should they do next? 1. Cover with a warm blanket. 2. Check for a DNR order. 3. Apply oxygen. Or 4. Notify the nurse immediately. You've got about 15 seconds left. Go ahead and lock in your final answer. What do you guys think? What do we want to do for this person? Shallow breathing and blue lips. What does it mean? Means we should notify the nurse. Absolutely. This is a change in the patient. DNR orders have no bearing on this whatsoever. If you're in the chart checking for a DNR order, who's taking care of the patient? What's happening with that patient? So the DNR order does not help the patient. Remember, emergencies require action. ERA. Emergencies require action. And that action for CNAs is notify the nurse. We've got to let somebody know that this patient has shallow breathing and blue lips. And then the nurse will instruct us on what to do from that point. So Nathabo came in first, followed by Catherine, Renee, and Amelia. That was a hard question, I know. Question number 12. A resident with dementia starts yelling and pacing. What should the CNA do? 1. Restrain them so they don't strike you. 2. Redirect calmly and notify the nurse. 3. Yell back. Or 4. Restrict them to their room. A resident with dementia starts yelling and pacing. What should the CNA do? 1. Restrain them so they don't strike you. 2. Redirect calmly and notify the nurse. 3. Yell back. Or 4. Restrict them to their room. What do we want to do here? Go ahead and lock in your final answer. You've got about 15 seconds left. What do we want to do? So the right answer here is 2. Most of you guys got this one right. Yeah, we're going to redirect them calmly. Most of the time, dementia patients that are agitated, they need us to figure out what's making them agitated. And sometimes this is as simple as a break in routine or a feeling that they're not able to identify. So yelling at them, restricting them to their rooms, restraining them, all of those things are just going to escalate the situation. What we want to do is remain very calm and try to figure out how to help them because there's something that they're not able to cope with. And that's why we're there to help. So redirect calmly and notify the nurse. Danica came in first, followed by Catherine, Nathabo, and Renee. Good job. Question number 13. Which of the following should always be reported immediately? 1. Any sudden change. 2. A resident who declines a shower. 3. Hand tremors in a Parkinson's patient. Or 4. 100% intake for a diabetic patient. So which of the following should always be reported immediately? 1. Any sudden change. 2. A resident who declines a shower. 3. Hand tremors in a Parkinson's patient. Or 4. 100% intake for a diabetic patient. Go ahead and lock in your final answer. You've got about 15 seconds left. I almost didn't use this question. I'm going to tell you why I did. Hold on one second. This is an easy one, isn't it? It's super easy. You will have some easy questions on the test. Yeah, any sudden change. We've already talked about this. We've talked about this a lot in today's lesson. Anything sudden has to be reported. And I almost didn't use this question. I wrote it because that's exactly what I'm trying to get across to you, right? Anything sudden has to be reported. And I wrote the question and put it at the beginning, and then I moved it to the end because I really want to make sure that you get this concept. The others, those are all normal. Residents are going to decline showers now and then. Hand tremors are normal in Parkinson's patients as part of the disease process. And 100% intake for diabetic patients, that's what we want to see because we're managing their meds and their food. But anything sudden has to be reported. So Catherine came in first, followed by Danica, Renee, and Nathabo. So good job, guys. Question 14. A resident is unresponsive. What is a CNA's first action after calling for help? 1. Check for a pulse and breathing. 2. Get an AED and attach it. 3. Apply oxygen. Or 4. Perform a sternal rub. A resident is unresponsive. What is the CNA's first action after calling for help? 1. Check for a pulse and breathing. 2. Get an AED and attach it. 3. Apply oxygen. Or 4. Perform a sternal rub. This is all about emergency processes and scope of practice. And this is a very common type of question that you're going to see on the state exam. You've got about 5 seconds left. Go ahead and lock in your final answer. The right answer here is 1. Check for a pulse and breathing. And this is the appropriate emergency action. We call for help. We assess the patient. We check. Are they breathing? Do they have a pulse? If you just don't do that and just go get an AED, we're missing out on an opportunity to start CPR. If you just apply oxygen, that's outside of your scope of practice. That's not what CNAs are allowed to do. And performing a sternal rub, that is absolutely outside of your scope of practice. That is never the responsibility of the CNA. So this is all about knowing your scope of practice and emergency procedures. Danica came in first, followed by Catherine, Renee, and Nathabo. Last question. Here we go. A resident is found bleeding from the leg. The CNA should, 1. Apply a sterile dressing. 2. Look for the cause of the injury. 3. Elevate the leg above the heart. Or 4. Apply pressure and call the nurse. So a resident is found bleeding from the leg. The CNA should, 1. Apply a sterile dressing. 2. Look for the cause of injury. 3. Elevate the leg above the heart. Or 4. Apply pressure and call the nurse. So go ahead and lock in your final answer. Dana, I'll get to your question in a minute. Got about 15 seconds left. Final answer. This is asking you about emergency processes for bleeding. Again, it's first aid. and scope of practice. So we're going to apply pressure and call the nurse. Remember, we never leave our patients alone in an emergency. CNAs never apply sterile dressings. That word sterile is outside of your scope of practice, not your scope. We don't look for the cause of injury. There's no need to. We can't fix that. We have to take care of the patient. The patient is what is in front of us. The patient needs our assistance. Looking for the cause of injury is not helping the patient. Elevating the leg above the heart, that's not stopping the bleeding. It may slow it down a little bit, but it's not taking care of the problem. So we don't elevate the leg above the heart. We apply pressure and notify the nurse. So Renee came in first, followed by Nathabo, Ethan, and Neil. So let's see how our final scores are. Catherine is first place. You get a t-shirt. Danica came in second place for the card game, and Nathabo is going to get the badge holder and motivational gift. So good job, guys. Very good job. Dania asked, and please repeat why it isn't 2, and I think you were referring to the AED question. So if somebody is unresponsive, the AED may help, but that's not the very first action we do. We start CPR and we send somebody for the AED, because in the time it takes you to go get the AED and come back, your patient has been without oxygen to their brain. And even if that AED were to bring, to be able to restart the heart, to interrupt that abnormal rhythm, they may be brain dead from lack of oxygen. So CPR has to come first. I hope that helps you. All right, guys. So I want to talk to you really quickly. Give me just a second. I want to talk to you about this. Okay, so this test plan here, I think it's over here. This test plan, okay, this tells us, you're welcome, this tells us the types of questions that are going to be in a specific category on the state exam. And I want you to look at the title of this category. This is providing basic nursing care by a nurse aide. So basic nursing care. What does that mean? Well, when we think about nursing care, most of you guys, I just want to go here for a second. Where is it? Most of you guys think about this instead. Oops. Let me get that larger. When you think about basic nursing care, this is what most of you guys think about. This. Skills. That actually isn't basic nursing care. This is promotion of function and health of resident. This is skills. Bathing, dressing, feeding, grooming, toileting, mobility. Those are not basic nursing skills. This is promotion of function and health. This is going to take up 20% of your test, but 24% is what we just went over. Basic nursing care, which is all about emergencies. Recognizing what needs emergency intervention. And that's the one thing that I really wanted to bring to your attention for the written test, because in our minds we tend to get these two confused a lot. We think that the skills we do is basic nursing care. It's not. That's just promotion of health, keeping them at their baseline. Working with emergencies, being able to recognize them, being able to see changes and get them the help they need. That is what basic nursing care is going to test you on the state exam. So it's important that you understand that, because the vast majority of questions on the state exam is going to be from this category, which is all about recognizing and responding to emergencies within our scope of practice the right way. I hope that helps you guys understand a little bit more about the state exam and helps you identify how to answer those questions the correct way. And again, I thank you guys so much for your patience this morning. We're working through our growing pains, but I'm super excited now because I've got a computer that can let me do what I need to do. I've got a really big desk that'll let me spread everything out so I can cross reference. I'm super excited about how my office is coming together. And of course, that means growing pains for all of the tech that we do. But I really appreciate you guys. So, those of you guys that won, the ones that won, I need you to send me an email. You're going to tell me your screen name, your real name, what place you came in, and then your mailing address for us to send you, your yeah, I'll talk about that. For us to send you your prizes. So send me an email to 4YourCNA@gmail.com. Give me your screen name, your real name, what place you came in, and your address. We'll get those prizes out to you this week. So first place was Catherine. Catherine, you are able to choose from the t-shirts. This is the class shirt. Screen name. Helen, it's some of you guys have screen names. What I see on YouTube that's different from your actual name, like Blue Jedi. That is not her name. Her name is Heidi. I know that. So that's what screen name means, is what I see on YouTube. So for you, it's probably that's probably your actual name. Blue, yes, my puppies were tremendous help in setting up my new desk and my computer and everything else. And by tremendous help, I mean they were not helpful at all. They got into absolutely everything, but they are so cute that I forgive them. All right. If anybody wants a kind of behind the scenes view of what my new office looks like and everything that we have put in place, let me know. Give me some feedback. If you guys would be interested in seeing a behind the scenes, I'll make that happen for you. And we'll kind of take you on it's actually a really small room, but I'll take you on a little tour. If you're interested, we can do that in the future. I know I'm working on it, Heidi. I really am. We have some really exciting things coming. I'm actually renovating an entire room in my home. It's a suite. We're putting in water access and cabinets, and the hospital bed is already in there. We've already got the flooring done. We're working on the lighting, and I'm creating a complete taping studio right here where I can just pop in and tape a skills video as the need comes up. This is really going to help speed up our videoing efforts, and I'm really excited about that, and very thankful to all the people that are breaking their backs helping me make this possible. So I'm really excited about what we have coming up. So I'm going to go ahead and sign off. I apologize for keeping you guys a little bit late. Renee says, thank you so much. I just sent my paperwork in to get tested. In the meantime, I'm using your tools and resources. They're helping me a lot. Thank you for this platform. Well, thank you, Renee. Thank you so much for including us in your journey. If you go to flcnatraining.com, let me put that in there for you. You can see replays of my classroom program, but there's worksheets on there that are free. You can download those worksheets, print them out, and if you fill those worksheets out, it actually creates a really effective study packet that just focuses on the very specific things you need to know for the written and the skills tests. So those worksheets might help you as you prepare for the test. Yes, dogs always love to help. Absolutely. Yes, Henry, you can access this recording for future reference. It's going to be on my YouTube channel, so it's youtube.com. 4YourCNA, and just look for the playlist of the game show. And I've got, I don't know, something like close to 30 game shows on there. So it might help you prepare for the test. There's a lot of questions out there. Okay, we will go ahead and get your prizes out, those of you who won. Thank you guys so much for spending time with me today, and I hope you have a fantastic week. Go do something fun. Remember that Father's Day is coming up. Congratulations to all the graduates out there as well. And until next time, guys, happy caregiving. Bye.